Okay. Good afternoon, everybody. It is Fertility Talk Live. Today we are talking to Debra, and she's from Supreme Fertility. Thank you for joining us, Debra, and taking your time out to have this talk with us. Today's talk, we are discussing the uncomfortable truth about sperm health. And it's a subject, when you're talking about sperm, it's always the, male infertility is always quite a big thing. And men normally don't like to speak about it. It's very uncomfortable for them. So I don't know if Debra's still there. Debra, you there?
Yes, I'm here, yeah.
Okay, great. Your picture's just, I think there's something wrong with your connection or something. But yeah, so we're discussing that today. And I'm going to hand over to Debra and she can carry on. Thanks, Debra.
No problem. No, thanks for having us here. And yeah, as you were saying, the topic about sperm health, it is quite a sensitive topic. And as we all know, when you're looking at fertility, if a couple has been struggling for more than 12 months to fall pregnant and have a baby, that we classify them as being infertile. And age is also a very important factor there as well. So as they get older than 35, we would reduce that time to about 6 months, and older than 39, even 3 months. So when we are looking at the older couples, and particularly the men, when they are trying to have a baby, they really need to do what it takes to improve their sperm health, etc. So about 30% of the time we look and we address small issues with a woman, and 30% of the time with a man, and 30% of the time there's often issues with both of them that we need to take a look at. And I always like to use the analogy of an ostrich. We know we've all seen the little picture with an ostrich sticking its head in the ground.
Yeah.
And trying to, not really deal with everything at hand. And there's men are really like that as well. They always like to think when it comes to fertility problems, that the problem lies with the woman, and the woman needs to change her diet, and the woman must take the supplements and stuff that are all needed. But often what they don't realize is that men are also exposed to many different factors in not only their diet and their lifestyle, they're also using various drugs and supplements, etc. They have chronic diseases. Their work environment may potentially be a factor as well. And all those things that they're exposed to on a daily basis can affect the quality of the sperm. Now, men produce about 50 to 60,000 sperm per minute when they hit puberty. And to be able to conceive, you've got to have a good sperm count, a good sperm morphology, and a good sperm motility. Now we are seeing more and more men that can have problems with either one of these factors. So either the counts and the shape of the sperm or the motility of the sperm. Now, when we're talking about the shape of the sperm, we are seeing more and more men that now have sperm with large heads, small heads, and the sperm could have 2 heads, 2 tails, or even one of these other little squiggly kind of different options that can also happen. Now, these abnormal sperm can still fertilize an egg, but it may potentially result in complications further down the road. So we ideally want a healthy sperm and a healthy egg, which will result in a healthy embryo. So what people don't realize, it's often damage to the sperm that can cause miscarriages and complications and problems later on as well. So just a little bit of a physiology about the sperm. Everybody's seen little sperm pictures, they know what it looks like, but it really consists of a head, a neck, and a sort of a tail, which is a squiggly spot that helps it to swim. But now when these various dietary and environmental factors, etc., cause damage to the sperm, particularly to the tail of the sperm can't really swim easily, and it has difficulty in binding to the sperm, etc. And you can also have damage to the head of the sperm, and that can also potentially result in infertility problems and miscarriages and things like that later on as well. So there really is many different factors that can play a role in damage to the sperm. Okay, now the first one that we already mentioned looking earlier is the age. Now, paternal age also has a role to play. It's not quite as impactful as a woman's age, but it definitely does have a role to play there as well. The diet and lifestyle, any chemo and radiotherapy, and even obesity, various environmental toxins, and even infections can all have a role, not only in infertility, but sometimes we're seeing more of these men that have unexplained infertility, etc. And even very important when you start looking at things like assisted reproductive procedures, such as your sperm injections, your IVFs, people that are having recurrent pregnancy losses and miscarriage, etc. And even then, we need to look at that as well when people have babies with birth complications and things like that too. But probably one of the most important factors that we've put a lot of research, and there has been a lot of research done. We've actually got a database of all this research. If anybody would like to review it, they're welcome to contact me at support@supremefertility.co.za, and I can provide them more information and articles to read on this as well. But one of the prominent factors, as I said, is oxidative stress. What that damages the sperm. And what that really is, it's an imbalance between something called free radicals and the body's ability to actually neutralize and keep this process in balance. Now, what kind of things can cause oxidative stress damage, and I'm going to look at that in a second. But what the research has also shown is that about 25 to 80% of these male infertility cases can be linked to oxidative stress of some form. Now, this is what we say, why I like to highlight the topic of this talk is the uncomfortable truth about sperm health, because it's things that men don't want to hear about, and they like only hearing the things that they feel they want to do and the changes they want to make. So we're looking at things like smoking, stress, excessive alcohol usage, bad diet that is high in refined sugars, high in fats, all those kind of things, age, even cancer. And there's various pollutants and toxins in the environment, too much caffeine intake, and certain drugs as well can all cause this increase oxidative stress that can damage the sperm. And something else that most people tend to forget about is even too much exercise. Now, we know exercise is a really good thing, but if you are working with people preparing for the comrades or for the Argus, for instance, and spending many hours a day on a bicycle seat, this can affect their fertility, and you may even see increased rates of cancer in cases like that as well. So it's definitely something to watch out for as well. And then again, where are the men working? In our consultations, we do a thorough, in-depth look at their whole diet and their lifestyle as well, because often people are exposed to various toxins and chemicals that they aren't even aware of. And that's what we like to highlight and help them clean up their environments and things like that as well. So oxidative stress, people can be more susceptible to damage by this oxidative stress as well if they have certain DNA and genetic variants that can increase their risks. So one of the services we do offer is DNA testing. It's a fertility DNA panel, and it's a buccal swab. We collect some DNA from inside the cheek, a very simple process. It only takes about a minute, and there's no blood or pain or anything like that involved. And after about 3 weeks, we can get a thorough reports of both the couple, so the man and the wife, their DNA results. And when we have a closer look at that, we can find potential risk areas that could be increasing their risk of things like oxidative stress, etc. So all these genes that we test for, we can help them put dietary changes, help them with the right supplement protocol, etc., to reduce this risk of these potential things happening. So as I've mentioned, diet, lifestyle, work environment, supplements, drugs, etc., all have a very important role to play in sperm health. Okay, now these one of our supplements that we do have is a supplement called the Essential Support, which is our amino acid and our antioxidant supplements. And what these amino acids really do is it decreases the free radicals that cause all this damage and affect the sperm health and stuff like that as well. And it actually helps to repair damage in certain cases. So there are, if you get a lot more technical, you get enzymatic antioxidants and you get non-enzymatic etc. So I'm not going to go into too much detail about all of that right now. But what the studies have actually shown that supplementing with the right kind of antioxidants or a combination of antioxidants can enhance semen parameters and even sperm DNA integrity in men that are struggling with infertility as well. And we do recommend that they use antioxidants for at least 3 months.
Was going to be my question. Sorry.
Yes, no problem. For 3 months. But even if they're planning to go for things like assisted reproductive therapies or IVFs, because it doesn't help going for those procedures if they're going to retrieve egg and sperm that have DNA damage. So we recommend prepare correctly, and you'll also help to increase the success rates, etc. And we also, the patients need to be working with healthcare practitioners as well, because often they don't realize that vitamins and minerals and supplements can also have side effects to play. So if they start using things like antioxidants in the wrong doses or for too long periods of time, it can actually cause damage as well. So that's also what we help them work through and look at. So just what I wanted to mention as well is something that most people don't know about is our essential support antioxidants, for instance, contain key network antioxidants. I don't even know if most people will know what that is, but there are 5. It's vitamin C, E, CoQ10, lipoic acid, and glutathione. And what these key network antioxidants really do is if a patient takes something like vitamin E, for instance, and it comes into contact with a free radical, it will neutralize that free radical. But in the process itself becomes highly reactive and it can cause all sorts of damage. So if you actually go and Google something like vitamin E and side effects, you will see it can actually cause a lot of damage. But if you give it together with other key network antioxidants, etc., it can stabilize it back in the right form that can actually help to clean up all these free radicals, etc. So in our supplements, we do cover all 5 of these key network antioxidants between 2 of our supplements, etc. So just some dietary and lifestyle factors that I quickly want to mention that are important for sperm health and people don't always know about. And the first one is sleep. You need to get enough sleep. Okay. Yeah. The second thing is smoking. Now, that's another one that men like to stick their heads in the ground. If they are smokers, it is very, very important that they prepare to give up the smoking because it has a very important role to play in the quality of the sperm health, etc. And this is something that they find very difficult. We are also actually starting a support group on Wednesday evenings, 7 o'clock on a Wednesday evening. So if anybody would like to join that, we do help the patients realize as well that they're not alone. We give them a little bit of an educational, for instance, how they can support the sperm health, what kind of supplement should they need. They get to meet each other and ask a whole lot of questions, etc. Okay. But back to the smoking.
So sorry, while you're busy with that, could you tell us how they can get connected with you to join the support group?
Sure. So they're welcome also just to send an email to me directly, support@supremefertility.co.za. We also have a link on our Instagram page. They can also link, it'll open up a little form. They can sign up there as well. Or any one of our channels, we will be able to send them the Zoom link for that. So it is quite nice. They realize that they're not alone. It's very common, these infertility issues, and it's sometimes nice to meet people going through the same thing as you. Yes. And to find out for something like smoking, it's hard to stop smoking and it's hard to change your eating habits. But with a bit of support, I think it makes it a lot easier as well. Yeah. And then just other things like drugs and supplements, and sometimes natural drugs and supplements, people forget, can affect not only your fertility, but it can affect the functioning of your mitochondria, which is produces all the energy in the body. And this is very important for cell division, but also for sperm health and things like that as well. So we like to have a good look at patients' drug usage, supplements that they are using, and helps us to clean up that as well. What is essential for sperm health is we encourage patients to increase the amount of natural antioxidants and stuff that they are getting as well from their food. And I personally like to recommend that they get at least 7 to 9 portions of brightly colored fruits and vegetables every single day, because it's something that people usually lack in their diet. So we want those bright greens, the yellows, the reds, and the grapes, even things like avos, very, very important to help support sperm health as well. Also important is natural fats in a patient's diet. So yeah, we're looking at things like unsalted nuts and seeds, avocados, cold pressed olive oils, your fatty fishes, olives, those kind of things as well. Another important factor that I want to mention when it comes to diet is the reducing the amount of saturated fat intake in diet. And this is another one that the men really struggle with, because what foods are high in saturated fat? It's all the food that the men like. So it's your processed meats, the dried meats, the dairy, the creams, the butter, those kind of things as well. That's very important. It doesn't only affect their weight as well, but it does cause increased oxidative stress and that damage to the sperm as well. Just other factors, we find out, are you exposed to any chemicals at work, but not only at work, at home? What kind of household chemicals and cleaners and personal care products are you using, etc.? They can also potentially contain endocrine disruptors and factors that can cause oxidative stress, etc. Just quickly, just a few more things I just want to highlight as well about the diet and lifestyle. And one is stress. We all stressed, and now COVID in the last year as well as even contributed to this significantly. But what stress does is it actually increases cortisol levels in the body as well, and it can throw testosterone levels also out of balance, and thyroid and all sorts of things like that. And also increase has a role in weight gain and things like that as well. So we do encourage that they get some exercise, balance their stress as much as possible, and get help if they need to. Okay, so our particular supplements that we like to recommend as well, we've got a lot of research in them, and they contain a lot of essential ingredients to improve the sperm count, the quality, the motility of the sperm, etc. And I'm going to just mention some of these compounds that are very important to do that. And it's things like arginine, citrulline, carnitine, your CoQ10, folate is another important one, myo-inositol, a lot of research around that now as well, glutathione, B12, and there's a lot more. They can get more information off our website as well. That's www.supremefertility.co.za, or welcome to email me directly again, as I've mentioned, support@supremefertility.co.za as well. Okay, so in a nutshell, to ensure that you've got good sperm health, we really need to look at a holistic viewpoint. I know people want to drink a pill, they want to take just something just to fix everything, but they're not prepared to do what it really takes. But if you're serious about having a baby, particularly if you're approaching now your late 30s, 40s, you've got to do what it takes. So you need to clean up your diet, your lifestyle, look at the drugs and supplements that you are using, etc. And we even recommend doing the DNA testing if you can afford to, so we can find those risk factors and help you put steps and stuff in place as well. So just a reminder of that support group as well. We are starting next Wednesday evening. If anybody would like to join that, please just look us up on email, drop us a message on any one of our social media platforms or the internet. So that's pretty much a little bit more about sperm health. I don't know if anybody has any more questions or anything that I think that you may think I might have missed, Leanne. I'm
actually just thinking, I'm so glad that we did this subject, because we talk about it all the time, but it's important because it's always on the woman. You know, the woman has to go sit at the doctor's surgery. She's got to go and lay on the bed. I'm just being open and straightforward. You're laying there, you're going to have all these scans and all these blood tests and stuff, and the men are sitting home like, you know, everything is fine. I'm not saying men are not supportive or anything. There are a lot of husbands that are supportive. I'm just actually checking my so you know, it's always about the woman, and no one's ever considering that it actually could be the men, the sperm health that actually could affect you from you know, carrying full term or something, which I never actually thought of, to be honest.
And even miscarriages, which is another common one. Sometimes it's the sperm that's causing the miscarriages,
which you wouldn't think. You'd be like, how could it be? Yes. You know, it's something that the woman has done. Is she smoking? Is she drinking? Did she do something wrong? When in actual fact it started from the beginning. So it's very important to actually get these tests done. And I just want a quick question: do you guys do the sperm analysis? Do they kind of do it through you, or do you recommend going somewhere, or what happens with that?
Leanne, we don't physically do any sperm analysis, but we work with healthcare practitioners across the country. So a lot of our practitioners are doctors, some of them are even gynaes, etc. So if they would potentially look at the sperm counts and things as well, and we even recommend doing that, looking at the sperm parameters, the sperm count, the morphology, etc., doing the Supreme Fertility program for 3 months and making these dietary and lifestyle changes and supplementations, etc., and then retesting after the 3-month period. And it's really nice to see how all these sperm parameters and stuff do improve. So absolutely, if they do require sperm analysis or testing, they're welcome to get in touch with me, and we can put them in contact with somebody that can do that as well.
That is perfect. And one thing that you've mentioned twice now is that they need to do, it's a 3-month period. I always say, because people tend to take it for 1 month, and they would take something for 1 month. They purchase a supplement from me and take it for 1 month and think, okay, everything should be fine. And I always say, please remember, at least do the test before to see what you're working with. Take it for 3 months and then do another test so we can see, you know, has there been an increase, has there been a change and everything. But again, it must be 3 months, not just 1 week and expect everything to work perfectly. So thank you very much.
Now, what people don't realize is it takes around about 72 days for a sperm to reach full maturity. So sometimes people use supplements or they eat correctly for about 2 weeks, which is probably like a stretch for most men, etc. And then they go to a party and they overindulge in alcohol, cigarette smoke, etc. So the DNA of the sperm, or even the DNA of the egg for that matter, can be damaged right before ovulation.
Yes. Okay, wow. Thank you very much, Debra, for taking time out to chat to us again today. If you guys want to get hold of Debra, her email address is support@fertility, Supreme Fertility. supremefertility.co.za, and you can also contact on their website, www.supremefertility.co.za. Thank you very much for your time and have a lovely weekend, Debra.
Thanks, Leanne. You too. Thanks for having me.
Bye. Bye.